Hello, everyone. This is a presentation by Tracy Williams Eaton addressing inequality in health among pregnant women in urban areas. Prenatal care is especially important to reducing the risk of pregnancy related complications for moms and infants. A woman's perception of whether care is useful or supported affects the quality of prenatal services. Having awareness of these barriers can help us as health and human service professionals be more impactful in the work that we do with our families. Here is a list of my agenda slides and the topics that we will discuss during this presentation. Health inequality in pregnant women in urban populations. A little background and overview of health disparities in urban areas. There are some key statistics on prenatal care, health outcomes for low income women. Also, I will be sharing the importance of addressing barriers to care, transportation, and systematic racism. Accessing reliable transportation is a critical factor in healthcare access, particularly in pregnant women in urban areas. Limited transportation options often make it difficult for these women to attend prenatal appointments, which are essential for monitoring the health of both mother and baby. Regular prenatal care helps identify potential complications such as preterm birth, low birth weight, and provide opportunities for early intervention. There has been significant of issues and is underscored by alarming maternal health statistics. According to the Kaiser Family Foundation, Black women experience a much higher maternal mortality rate compared to other racial groups. From 2021 to 2023, there was only 58.4% of women in urban areas that had births compared to 69.7% in rural areas. The maternal mortality rate among Black women was 49.5 deaths per 100,000 live births in 2022, compared to 19 for white women and 16.9 for Hispanic women and 13.2 for Asian women. These disparities highlight the urgent need to address barriers like transportation, which disproportionately affect marginalized communities. Which brings me to my hypothesis. With limited access to reliable transportation, significantly reduces the frequency of prenatal appointments attended by pregnant women in urban areas, leading to poor health outcomes. By addressing these challenges, it requires fostering some change in attitudes and behaviors among community members, healthcare providers, and policymakers. By adopting culturally sensitive and equitable practices, we can improve access and continual of prenatal care, which can empower women with the tools and resources to advocate for their own care. Understanding their options, helping them navigate the healthcare system effectively is critical to overcome these barriers. Research was conducted using Franklin University, Google Scholar, books, gathering information on prenatal care in urban areas, a developed and distributed 10 question survey to 40 plus participants. 25 responses were analyzed. There was a combination of multiple choice, open end questions with one fill in question. The survey was administered anonymously to African American women who were either currently pregnant or had previous births. Questions were centered around access to adequate prenatal care and the barriers that women experience by these populations. The article's review provided statistical data and empirical support regarding the challenges women in urban areas face. Some of the key barriers identified in both literature and in the survey responses, which were included, were transportation issues was the number one, financial costs, distance to health care providers, long wait time for appointments. Some of my key findings was 76 of respondents reported that their healthcare provider listened to them. 20% indicated that their provider only somewhat addressed their concerns. And 10 out of the 25 women, about 40%, reported experiencing challenges related to health inequalities during pregnancy while living in urban areas. The survey results confirm some of the systematic barriers previously identified in research, such as transportation issues and appointment availability, which remain significant obstacles for this population. The findings in this study align with my hypothesis, which suggests that barriers to equity in prenatal care, such as financial constraints, travel challenges, and culturally insensitive practices, discourage pregnant women from engaging in continuity of care. This reality reflects broader systematic issues, including mistrust in the healthcare system, particularly among women in urban areas. I asked a question: why do you think this is? The answer lies in a systematic inequity that persists across healthcare systems, deeply rooted in historical and ongoing racial and social economic disparities. These inequalities lead to a lack of culturally competent care, a perpetuous stereotypes, and a fail to address the specific needs of women. Barriers to prenatal care. It limits access to reliable transportation, reducing prenatal care visits for pregnant women in urban areas, leading to higher risks and poor outcomes. Barriers to equity in prenatal care are multifaceted, encompassing travel challenges, financial burdens, and culturally insensitive practices that discourage engagement and continuity of care. Culturally insensitive practices also discourages engagement and continuity of care. In urban areas, these practices, along with systematic racism, undermines the trust in healthcare providers, which exacerbates disparities in maternal health. Microaggressions and implicit bias in patient-provider interactions. It contributes to these dynamics. And if we could address these issues, it is critical for improving engagement and the continuity of care among marginalized population, with disparities requiring not only access to transportation, but also understanding the content and the quality of prenatal care services. Prenatal care is an important opportunity to prevent pregnancy related deaths, yet, the delivery of care is often limited by time and resource constraints. Improving prenatal care requires addressing transportation barriers, which limit access, increase health risks, and worsen outcomes for pregnant women in urban areas. Higher risk related deaths and prenatal barriers, one being transportation issues from missed appointments, increased risk, financial barriers, which cause costly care, reduces access, and healthcare inequalities like racial disparities still persist. The impact on a pregnant mom is poor outcomes for the mom and the baby, according to the Center for Disease Control. Prenatal, pre, pregnancy related deaths. Addressing these financial and non medical challenges is vital to improving maternal infant outcomes. There's nearly 1 in 4 United States pregnancy lack adequate prenatal care, increasing health risks. Maternal mortality rates in rural counties by race. 100,000 live births is 59.3% in Black women, and it's only 19.7 in white women, as you can see. These are real statistics. Significant racial and geographic inequalities remain unaddressed. Key takeaways in conclusion: and maternal health disparities. Future directions: invest in policies and outreach and systematic change to improve access. And prenatal care is crucial. It's important for pregnant women to have timely care in preventing maternal and infant risk. Barriers to access. We can address financial, systematic, and logistical challenges. Addressing inequalities is essential if we can emphasize culturally sensitive, equitable healthcare practices for all people. Financial and systematic hurdles limit care for undeserved communities. In the future direction, I would like to see and be encouraged and invest in systematic change, policies, and outreach and programs. This is a call to action. This project underscores the urgent need for policy changes to address systematic inequalities, community-based solutions to provide accessible, affordable care, and to bring awareness campaigns to educate policymakers, healthcare providers, and communities about these challenges. Just think about it. Thank you.